So Dr. Pete, Viagra, the magical blue pill, what can it do?
It was a real revolution in sexual medicine. It's the first pill to treat ED, and it's been kind of an amazing breakthrough.
Yeah, no, that's what I'm saying. My question is, what can't it do literally? What's up, everybody? I'm JC Mendoza. Welcome to Uncomfortable Questions, where I get to ask a doctor questions that we're all dying to know, but might be too embarrassed to ask about. And with me, as always, is the one and only Dr. Peter Stahl, who is a board-certified urologist and a nationally recognized leader in male sexual medicine. So, Dr. Pete, Viagra, the magic blue pill. I mean, what can't this thing do?
Viagra was developed as a blood pressure medicine. Very quickly, it was recognized people getting treated were getting better erections. And so it was FDA approved. It was the first FDA approved ED drug, and it was approved to treat erectile dysfunction. It works by relaxing the smooth muscle in the penis, which lets blood flow in faster, lets the penis fill up with blood and get hard, stay hard. You might hear the word sildenafil. That's the generic ingredient that is the active part of Viagra. What's really interesting is that over the past decade or so, another different indication for sildenafil has emerged in the sexual medicine literature, and that's actually to treat premature ejaculation.
Oh, really? So you would say that sildenafil can maybe help guys last longer in bed?
A fair amount of evidence has emerged that ED medications, which are called PDE5 inhibitors,
right,
and they're effective in a couple of ways. First, they often, but not always, improve ejaculatory latency. So that's like the time from penetration to orgasm. That's like what people with PE struggle with primarily.
That's what we're looking for.
Now, there are a couple of studies that didn't show that benefit, but even the studies that didn't show that benefit showed that men who took sildenafil who had premature ejaculation felt more confident, felt like they had a better sense of control, and reported just more sexual satisfaction.
That's great. That sounds promising.
Over the course of my practice over the last 10 to 15 years, I went from almost never prescribing PDE5 inhibitors to using them almost primarily as a first step. And that's for a couple of reasons. Number one, you don't have to take them every day, as opposed to SSRIs, which is the other type of medication that I find really effective. Number two, we know they improve sexual quality of life, and sometimes that just means you still have an orgasm quickly the first time, but you can recover, go again, and end up with a net overall sexual experience that is more satisfying for both the patient and their partner. And number three, if it doesn't work, you can always start an SSRI after that, or you can even add one. There's actually a lot of emerging data that the combination of SSRIs and PDE5 inhibitors together is probably the most effective treatment for PE.
You guys heard it here first. PDE5 inhibitors, underrated. So if somebody wanted to try a prescription other than PDE5 inhibitors for PE, what would that look like?
Yeah, so we talked a little bit about SSRIs. Those are the antidepressant and anti-anxiety medications that have been repurposed and used off-label to prolong time to ejaculation in men with premature ejaculation. And those are really effective, but they're daily medicines. They have some side effects, and it's just like a discussion with the provider to figure out what the right fit is for a given person. There are other prescription medications, and then there are also over-the-counter options. So gels, creams, sprays that numb the penis a little bit, and that reduces sensation, definitely prolongs time to ejaculation, but come with a couple of downsides, like there's a risk of transferring the numbing agent to your partner, which can be hard to explain if you haven't told them you're using the medicine, especially. And they also, if you use too much, you can lose your erection because you can't feel anything. So there are downsides. It's also not super spontaneous, for a lot of people feel like it gets in the way. But those are great options too. And then there are behavioral techniques that are marginally effective in some men.
What were some of those behavioral techniques?
So squeeze therapy, which is literally squeezing the head of the penis.
My man.
Before ejaculation.
I like how we made eye contact when you said that.
It was disconcerting. And then there's start-stop therapy, which is kind of a fancy term for edging in a systematic, planned way.
Cool.
So those work a little bit, maybe really well for some people, but they're a little less evidence-based than some of the other treatments we talked about.
And back to sildenafil real quick. It can help you get an erection, maintain an erection, last longer. Are you sure that there isn't anything else that it can do?
Maybe we'll discover some new indications.
Do you think it could maybe make your penis bigger?
No.
What about increasing libido?
Yeah, so that's an interesting and complicated question. The answer is that sildenafil does absolutely nothing to affect brain signaling involved in sex drive. It does nothing to affect testosterone. But, if you're not confident about performance and erection quality, it's really hard to be excited about sex. And the anxiety about performance can, you know, crush,
Yeah.
squeeze someone's sex drive. So
True.
treating someone's ED can kind of really take that out of the equation, which allows their actual underlying sex drive, which is there,
Right.
to show up.
Okay, so what about stop you from getting tired, increasing your semen volume? Can it make you irresistible, Dr. Pete?
I think you're already irresistible, man. You don't need anything else.
Stop, my God. I came here for information and I got what I really came for, and that is acceptance and validation. Thank you so much, Dr. Pete.
You are welcome.
And thank you so much, everybody, for watching. We appreciate you guys. If you like what you saw, please remember to like, subscribe, comment, and follow for more content. Thank you, guys.